everybody, we're at 11:05, and so we're going to go ahead and get started. Again, this is the Manager for Mental Health 1, Supportive Management Practices. This is part 1 of a 2-part series. The second part, balancing performance management and mental health, will be taking place on Tuesday, and we'll talk more about that later. My name is Christopher Lynn-Logue. Again, happy for everyone to be here. I'm joined by my colleagues, Rachel Steinmetz, Alexander Medina, and Sophie Pose, who are all on the line and may have a chance to introduce themselves, but we're going to go ahead and get started. So before we get into the content, I want to go over a couple housekeeping/ground rules, really expectations for our time together today. Your video and audio is off during the webinar. We'll have a time later for question and answer, but the questions will be read from the chat. So if you have a question throughout the session, please feel free to enter it into the chat. I see there's been some chat activity already. We appreciate that. Let's remember to be respectful and civil. This is a learning environment. We're here to learn. We're presenting information to you all. You'll have questions. We want to share as much knowledge and content as possible, but let's be respectful and civil in the comments and in our engagement with each other. Anyone not adhering to these rules will be removed from the meeting, right? So this is a worst case scenario. We hope that this doesn't have to happen, but if it comes to it, we will remove them. All right. So about us, Thrive in Your Workplace, we are a local, a program that works with local employers to integrate mental health support into the workplace, right? So we work in a consultative manner with employers throughout the city and to help customize workplace mental health strategies for their particular workplace and implement programming. Everything that we do is free. Our trainings, our resources, our events are free, and it's all to support the resilience of New York City's workforce. We'll have an opportunity to speak more about this later, or if any questions, please feel free to reach out to us if you're interested in working us in a closer one-to-one relationship. Today's facilitator. So we have my colleague, Rachel, so I'm going to allow her to introduce herself and speak a little bit about her background and her role on our team. Rachel?
Good morning. Good morning, everyone. Thank you so much for joining us. So as Chris said, I'm Rachel Steinmetz. I work on the Thrive in Your Workplace team really closely with different organizations, and I've also been doing a lot of training, particularly since COVID hit, and I'm thrilled that you're all here for this really exciting training. Thank you, Chris.
No problem. Nice. And I'm Christopher Lynn-Logue. If you feel inclined, you can read my background there. I'm also on the Thrive in Your Workplace team. I am a social worker. My role on the Thrive team is the employer engagement manager. So engaging in conversations with different employers throughout the city, trying to encourage them to join our network and work on workplace mental health with them, right? So that's one major part of my role, but we're a team, and during COVID, we're doing all types of things. So we're getting these virtual trainings and events going. That has been a large part of my role, which I have relished. Right. Our goals for today. So hopefully by the end of the training, you all will gain an understanding about mental health and common mental health challenges, or increase your knowledge about these topics, understand the value and effectiveness of mental health support, right? So based on our conversation today, we hope that everyone increases their understanding and the effectiveness of being supportive to mental health in the workplace, and develop skills to support your own and your employees' well-being. So not only will you understand the value, but we're going to give you some skills that you can take and practice with yourself and with your employees and colleagues. So being a supportive manager is a balancing act. So we know that being a manager is hard, right? Oftentimes, you know, you're at a middle point of the organization where you're an employee and you have those above you who you have to respond to, but then you also have people below you that you are supervising, and that creates tension sometimes and makes it very difficult to be a manager, right? But managers play a crucial role in building a supportive environment at the workplace, right? Most employees, the first person that they interact with is their manager, right? So oftentimes, if they are in need of support, they may turn to their manager, and we encourage that as an employer. We say, hey, reach out to your supervisor or your manager, right? So managers, like we said, play a crucial part in supporting employees, but oftentimes managers face challenges because they may not feel supported by the organization or feel that they have the appropriate skill set to be as supportive as possible, right? So we understand that as well. One thing that we like to talk about as a social worker and as a mental health professional is putting on your own oxygen mask before you help others. All of us have been on planes, hopefully, and we know that that's something that they speak about. But really what this comes down to is we have to make sure that we are as close to mentally healthy as possible before we are able to assist other people, right? So we have to be breathing before we can put someone else's oxygen mask on, right? So hopefully throughout this training, we'll talk more and provide more context and support for you as a manager to support your employees. So quickly, I want to talk about the agenda. We're going to cover Workplace Mental Health 101. Then we'll go into mental health support, supportive management practices. We have a case study, a very excellent case study that we're excited about. And then we'll have some time for questions and answers. When we talk about mental health, we have to understand that it's a spectrum, right? So mental health in itself is a state of well-being in which people can cope with the normal stresses of life, work productivity, and contribute to their communities. So we always like to say we all have physical health and we all have mental health. So just like you take care of your physical body, we eat, we sleep, things like that, we work out with it, whatever it might be, we should also be working to try to take care of our mental health, right? When we talk about mental health problems, this is kind of a broad term, recognizing the spectrum, right? And so this could encompass some of the day-to-day stress that we might feel related to personal situations or professional situations. Now the stress that we're all feeling because of COVID-19, anxiety, things like that, are pretty much our day-to-day situations that may not be fully diagnosed, right, by a mental health professional. That's mental illness. Those are conditions that really affect people's thinkings, their moods, their behavior, and their day-to-day functioning in a longer period of time. And the key is that it's been diagnosed by a mental health professional, right? So some of us may not have diagnosed mental illnesses. Some of us may, but all of us may have mental health problems that we're dealing with because all of us have mental health, if that makes sense. All right. Mental health challenges as it affects us, it affects us in different ways, but as it affects us here, specifically in New York City. And I know that we have people on the meeting who are from other areas. So I apologize if this information is very New York specific, but we're in New York. 1 in 5 adults struggle with mental illness every year. That actually is a nationwide statistic, and it holds true for here in the city as well, right? And so this may be people who are officially diagnosed by a mental health professional, or people who know someone who is diagnosed by a mental health professional, right? So it has an effect on us. Suicide is the 6th leading cause of death, right? So suicide sometimes is as a result of depression or severe stress or anxiety, different situations, but it is classified as a mental health concern or problem or situation that we should be aware of, and it is the 6th leading cause of death. Here in New York City, over 500,000 people, adults, estimated to have depression, yet less than 40 of them receive care for it, right? So 500,000 people say they may be depressed, or it's estimated that they may be depressed, but only 40% of those people are seeking care for it. And these are just numbers of people who are reporting. The numbers could be higher based on people who have not reported, right? Mood disorders are the 3rd most common cause of hospitalizations between the age 18 and 44. And it's important to denote those ages because that's prime working time for most people. Most of us are employed by the time we're 18 and through 44 and beyond, but most of the workforce falls in that age range, right? And so, as we mentioned, mental illness affects people, the individual who may be experiencing the mental illness, but also the people around them, be it family or coworkers, what have you, right? So all of us have come in contact with someone who may be dealing with a mental illness. It affects us all. Now, we globally are experiencing this COVID pandemic, and it has had an effect on our mental health and well-being, right? Workplaces have had to transition the way they work. Some of us have the fortune of being able to move remote, which is good in terms of safety, but it has been a great stressor, right? Which we will cover a little bit more later, but that transition of going to work remote was a stressor, right? COVID itself has caused a lot of worry and anxiety. One study found 85% of workers feel worried and anxious that they themselves may catch COVID or that someone they know may catch COVID, right? 85% are also worried about their jobs. So even though some of us have been able to continue to work and transition during COVID, there's still a lot of worry and anxious energy spent about our jobs, right? And some of us are really struggling with employment-related matters, and that could include mental health, changes at work, and managing money at home, right? So COVID has affected our mental health, and it's important to acknowledge that. Then there's what we know about the effect of COVID on colleagues of color, and how here in New York City, COVID has disproportionately affected people of color, right? Frontline workers, people that don't have the privilege of working from home, they have to be physically in a space, are disproportionately people of color, making up 75% of the essential workers, right? And being an essential worker, we already know that increases your exposure and your risk, right? People of color are less likely to work in industries that have jobs that offer sick leave or a work culture that allows for time off as compared to their white employees, right? So if I'm a person of color and I work in an industry where I can't take off for sick, then I'm going into work while I'm sick, potentially risking other people, right? And then, you know, I don't have paid sick leave, so I don't feel comfortable taking time off. I need that money to sustain my family. So COVID has had a disproportionate effect on people of color. And not only does this affect them physically, but it affects them mentally as well, excuse me. Another thing that we have witnessed or are becoming more aware of during COVID is burnout, right? And so burnout itself is something that has been extremely noteworthy, right? The WHO declared it an occupational phenomenon last year. And so this is something that people have become more aware of, and are understanding it's important to put measures in place to prevent burnout. But during COVID, it's heightened. 73% reported burnout at the end of April, right? Kind of, we're here in the US and in New York, we were at the very height of COVID. And it increased, a 12% increase from the 61% in mid-February before COVID, right? What are some reasons that we may have seen that increase, right? Greater anxiety around every part of the virus response. That speaks to a lack of control, one of the contributors to burnout. Boundaries between work and home are blurred. Those of us who are working at home, we wake up, we eat, we go to work, we're watching our kids, we're engaging with our spouse and our family, still working. The workday allegedly ends at a set time, but we're still at our computer. There's no, the boundaries are blurred, right? And so it speaks to role confusion and ambiguity, another driver of burnout. Sheltering at home and isolation, we're communal people. People engage with other people. That's how we survive, that's how we thrive, and we enjoy that. We're isolated, we don't have that engagement, right? So we don't have that lack of community, which again is another driver of burnout. The pandemic has impacted communities differently, as we just saw with a couple slides. People of color, people that aren't allowed to work from home, the pandemic affects them differently, right? And so that speaks to a lack of fairness. And so it feels as if COVID is treating others unfairly, and we can't control that. That's another driver of burnout. And it's important to note these drivers of burnout. There are 6, and we do have a webinar on burnout. We'll talk about that later, because people often consider burnout as just having too much work, but really there are 6 drivers, and these are 4 of them that have been magnified because of COVID. All right, so we'll talk some more about that as well. But that was a lot of bad news, or a lot of troubling news. There is some good news. Most people that receive treatment for mental health, they can recover and live happy, active, effective lives. They can contribute to their workplace, to their family, to society, as long as they are meeting treatment that is adequate for them, right? Most individuals who experience mental illness will improve if they get diagnosed and receive treatment, right? 80% of employees, so this is where the workplace comes in, who are treated for mental health problems report job satisfaction, increased job satisfaction and productivity, right? So if I'm experiencing a mental health problem and I receive treatment and support, and I feel better about my job, I feel better about my productivity. So that means that employers have a unique opportunity to support their employees with their mental health challenges, right? The workplace can increase access to care and the quality of mental health care. A lot of people receive their mental health care and their health care period through their insurer, through a plan that is provided from their insurer. So workplaces can play a crucial part in ensuring that healthcare and mental health care is of quality and is accessible, right? Workplaces can create supportive environments to promote positive mental health. And there are several ways that employers can do that. We work with them on identifying ways, but managers play a key role in that, and we're going to get into that, right? Managers form strong relationships with their direct reports, and they influence organizational operations and culture, right? So like we mentioned earlier, A manager is supervising, has direct reports, but also is in an opportunity to meet with leadership and other leaders of the organization to help shape the culture of the workplace, right? And it's important to invest in workplace mental health and mental health in general and workplace mental health. The WHO, as we mentioned earlier, estimates $1 that is invested in prevention returns $4 in terms of health and productivity, right? So return on investment, very big. $1 brings you back $4 as long as we try to do this in a preventative way, right? And so it's important for organizations to support mental health. All right, so next we're going to get to mental health support. So I'm going to turn it over to Rachel.
Thank you so much, Chris, for that really helpful overview. And I think it's really important to make sure that we have this sort of baseline understanding of, some common mental health terms and challenges while we start talking about what it means to manage for mental health. So first I want to take a step back because some of you, why are we talking about mental health and management? What does that have to do with it? And I think there's a lot that management has to do with mental health. Our managers are the people that we interact with the most in our workday and really have a great effect, as Chris mentioned, to impact their relationship with us as their direct reports, and also reporting up to their leadership to be able to bring out some important different issues and really identify if there are some cultural issues that folks might be wanting to address at a larger level. So there are a variety of ways that managers and leaders can support their employee mental health, all of which start with focusing on your own individual mental health and well-being. As a famous mindfulness teacher said, if your compassion does not include yourself, it is incomplete. Managers cannot and should not be expected to guide their employees with care and compassion if they cannot model that behavior and demonstrate that they care personally about themselves and their employees' well-being. So the tools and tips provided in this section will provide a foundation for managers to build their own strong mental health so that they're prepared and ready to support that of their employees and also engage in some of the tough conversations that are really required as part of this work. So, as you see, the mental health trifecta for emotional well-being. These are all things we know and have seen before, and these guidelines come from the CDC, but they're so important that we really have to keep mentioning them every training that we do. So first, the importance of social support. Even though we're physical distancing, we can maintain our social connection to friends and families and loved ones. Stay in touch. Exercise and nutrition. So your mood and physical health are deeply, deeply linked from years and years of research. This can be challenging during COVID, especially with all the banana bread we've all been making, but it's important to maintain your healthy habits. Try to make sure you're getting enough sleep, eat a healthy diet, and at least try to get outside go to a walk, some indoor stretching. There are some great YouTube videos, and working out as much as you can. And finally, routine. So this is really important both as an individual outside of work and as a manager in the workplace. Structure is really grounding. And I think, as Chris mentioned, some of the stressors from COVID and burnout have really disrupted every facet of our daily routines. So I think one of the important elements for managers is to really look at what they're doing and how they can model the behavior that they want to see for their employees in setting up a routine. One of the questions we received before this training, which were fantastic, and we look forward to talking to you about them, was about setting boundaries. And I think that really comes back to this idea of setting a routine. What is your policy towards email? How are you setting those boundaries, both as a manager? Are you sending your employees lots of late night emails? Are you sending them lots of really fast deadlines for things that really don't need to be an important deadline? And how are you using email? One thing that I've seen throughout this work is that now we're sending more emails than ever for many of us because I'm not able to shout over my cubicle to Chris to say, hey, can you just give me this number? But so we've turned email into a sort of contest about who's fastest at responding and who can send, the most answers. So I think as an individual, try to set some boundaries around that. Let your staff know I'm going to be focusing on this training right now, so I'm not going to be available. And also encourage them to do the same. Let folks know that unless there's something that's really immediate, they don't need to send you a thank you email to note that they were responding to your email at 8 o'clock at night. So again, setting a routine can be really helpful with setting these boundaries and really working for how you manage yourself and your team during this challenging time. I also think it just relates to if you're not doing these things, social support, exercise, routine, your team is going to be able to notice. You know, if you live with other people, they're going to be able to notice, even if you don't. So it's really critically important, even when it's so hard to pull yourself away, to say, I'm stepping away, I'm going to get some water, I'm going to go walk my dog outside, because it does make a difference in how you interact with others. So an important piece of this, in addition to these 3 elements that we were talking about, is that mindfulness. Next slide, please. Thank you. So mindfulness can help improve your well-being and how you manage your staff.
Wait, which one?
Oh, sorry, y'all. Can we all
the
mute
answer
ourselves,
is only
please?
men who are penetrated by other men.
Thank you. So mindfulness can help us during this time by helping us notice our anxiety, which is generally a bad time to make these large decisions, and distinguish between reasonable fear and extra anxiety produced by the mind. It can also help us face the current situation of COVID and any challenging interactions that we're having with our employees by helping us address those feelings instead of pushing them away and reacting without thinking about how we can react in a mindful and compassionate way. Using mindfulness to build resilience, calm, and compassion can help us do the best we can under these circumstances, especially with our colleagues. Mindfulness makes you a better manager by making you more attuned to those around you so that you have greater understanding of what is happening so that you can help guide them. So mindfulness is also a term that gets thrown around a lot. So what are some of the key elements of what this actually is? Awareness of your current experience and the actions you perform. It's incredible how many of us can go through life on autopilot without really being aware of what we're doing and what is happening at that direct moment. Focusing your mind on the present, not the past or future. I think this is always challenging, but I think it's really challenging right now with COVID, when it's really hard to either not think about how fun the past was in some ways and how scary the future might be. And allowing an experience to occur without judging it to be good or bad. And I think this is another part where mindfulness really has access to the management experience. We all have a tendency to make snap judgments about folks. And this is something we'll talk about in the training next week that is really focused on performance management. But you know, it's much better to sort of say, I wonder what is happening right now, than saying that person's a big jerk because they are ignoring my emails. So based on practicing some of these elements of mindfulness, it will help improve your mood and positive emotions. It can decrease anxiety and burnout. And it's even been shown to improve physical health outcomes, such as heart disease, which is really incredible. Next slide, please. Okay, so how do you actually do this? So I like to use the acronym RAIN. RAIN is a simple practice for mindfulness that was developed by Tara Brach, who is a Buddhist psychologist. So this is something I think is helpful for all of us, but I think particularly if you have a challenging moment with a coworker or someone you manage, it can be really helpful for setting you up for success for the conversation about that. So the R stands for recognize. Recognize what is going on. This means consciously acknowledging in any given moment the thoughts or feelings and behaviors that are affecting us. It's noticing you're feeling burned out or anxious or angry. And it may sound simple, but this is actually what's called the magic moment in a lot of mindfulness training, because it's actually really hard, especially when we're upset or anxious, to get ourselves out of that, to actually realize, oh, I'm feeling something. So let's say, for instance, your employee does not send a report that they are supposed to send weekly, and you get an email from your manager about why this hasn't been done. Your gut reaction is probably going to be anger or annoyance or shame that you didn't do what you needed to do, or fear that something bad is going to happen to you or your team because this thing didn't happen. And the R is really about saying, oh, I'm feeling this, something is happening, and using that information to respond skillfully. So the second piece is to allow the experience to be there just as it is. This, again, to go back to our metaphor or example of your employee not doing something and you as a manager getting in trouble, means accepting what is happening, you know, really not trying to say, I'm not mad, it's just that they didn't do what they were supposed to do. And so, you know, I just need to like let them know what is happening. But really allowing like, oh, I'm feeling something, and, you know, not pushing it away or, you know, making it seem like a judgment, saying, well, they're just an idiot, and so that's why they did that. you're upset, and unfortunately, but fortunately, mindfulness really just requires you to be there with that. Then you want to investigate with kindness. So what is happening? Look to your physical body. You really hold stress in your body a lot. So a lot of the time, your throat might be tightening, your stomach might be churning, you might be grinding your teeth. But look at that and then figure out, how can I nurture myself with self-compassion? What do I need right now so that when I come back to this issue with an employee, which we will do and talk about, I'm ready to do that in a skillful way instead of sending a really mean email or yelling or even ignoring the issue, putting it away and then not addressing it until it becomes much bigger. So we like to provide this as a tool to really help us all practice mindfulness. Next slide, please. Okay, so we've just talked about all these different ways that you yourself as a manager can prepare yourself for these conversations. And again, I want to say that it's really critical. If you're not doing this yourself, you're not going to be able to support your team in your best way. And something we've heard from some folks is that there are a lot of folks in the workplace who might just think mindfulness is some sort of, hippy dippy thing. And, I'm from San Francisco, so I probably like that stuff more than others. But I also think there's a lot of evidence that shows that it really improves your management skills by allowing you to respond wisely to what the situation is instead of flying off the handle. Something we saw at the beginning of COVID is when managers and leaders were understandably incredibly stressed out due to this rapid transition, folks were really lashing out. And we had to work with some to take a step back and say, this is really hard. This is really hard for you and feeling responsible for all your team members. But sending these emails isn't really getting you what you want to do. So how can we look at that and address that issue? But managers can promote employee mental health in a variety of different ways. One, by leading with compassion, by modeling the supportive behaviors you want to see. Again, we talked about this by setting examples of boundaries. You can say to your staff, I'm going to go for a walk in the middle of the day. That's something that as a staff member, I often at least don't feel empowered to do, but if my boss is doing it, then I'm like, oh, okay, I guess I could do that too. So foster an environment, virtual and physical, that promotes positive mental health. Set guidelines around meetings and emails. Think about your tone. Think about, now that we're in this virtual environment, it can be really tricky to, manage how your information is going to be received. So really think about that environment. And even in the physical, while folks are working remotely, encourage them to stand, offer some yoga classes virtually. There are fun ways to do this. They can also be used to create opportunities for social support. This can be through movie clubs, through little jokes, but we really want to focus on maintaining these social ties, even though understandably, we're all kind of getting a little zoomed out. And share mental health resources widely. Another question that we received asked about how they can ensure access to mental health care. A lot of the time, your employer may offer some great resources through an employee assistance program and others, so you really want to make sure that you're reaching out to them. And also at the end of this presentation, we will offer some free resources available through Thrive for all New Yorkers. All right, so talking about mental health in the workplace. Now, this is something that we've addressed really, can you go back? Thank you. So one of the primary goals of this presentation is to really encourage managers to talk to other folks about mental health in the workplace. And there's this common misconception that employers have that they just can't talk about it, this sort of blanket thing. And we know that managers understandably and rightfully have concerns about engaging employees in these types of discussions of mental health. They're afraid of pushback and negativity, and people might even be hearing from their bosses, you don't ever mention that. But to the contrary, it's actually vital for employers to create a culture of acceptance that encourages employees to speak out about any mental health issues and makes it easy for them to access the care that they need. Though the structure of the law means that employers can't presume an individual has a mental health issue by asking, are you depressed, or any clinical diagnosis information, you can talk about it in a supportive way. And in the next slides, we're going to talk really directly about what that means. In general, focus on talking to your HR partners because they can help support you in these kinds of conversations. In addition, many EAP programs can also help you, particularly with employee issues if you think there is a concern around this. One partner that we worked with had a employee that they were worried had an eating disorder and reached out to their EAP, and the EAP was there for them every step of the way about what resources to offer, how to talk to the employee and connect them to care. So again, we want to make sure, and this is actually in response to one of the questions about accommodations, that we don't use that as a blanket statement that we can't talk about this in the workplace, but rather that there is a way to talk about this supportively in the workplace, and that there's a difference between mental illnesses that are documented and covered under the Americans with Disabilities Act and sort of general mental health challenges that really all of us are experiencing. As part of the Thrive in Your Workplace program, we partnered with the New York Legal Assistance Group to create a free webinar which talks about this in a really accessible way for non-lawyers like me. So how do we talk about this? There are 3 key questions that are about how we can talk about this. Next slide, please. So again, we'll start out with probably the most important general principle for how to have these conversations. The manager isn't to diagnose or attempt to treat what you think of as an employee mental health challenge. That's a lot of pressure to put on yourself. And I think that's probably what keeps some folks from inquiring openly about these concerns because they're so worried about, well, what do I do if sort of all these emotions come out? And what we're going to talk about today is that the 3 steps are inquiring about how people feel, listen actively, use supportive language, and then direct them to share those mental health resources and encourage people to seek help outside of the workplace, because those are the folks that are best going to be able to provide the kind of support that they need. Next slide. Okay. So some best practices in communication, and this again draws back to some of the mindfulness techniques we were talking about. Ask open-ended questions. How are you feeling? Has this been an issue before? We want to really start this out from a place of caring and empathy. While you're doing this on Zoom, turn off your email alerts. If you have an assistant, let them know that you are not going to be responding during this meeting that you've scheduled with your employee, and make sure that you turn over your phone. I think even if you think folks won't notice you looking, they will definitely notice, particularly in a conversation like this. We want to focus on addressing the emotional component of this so that we can then move on to the performance management issue. Honestly, once you address the emotion behind it, it can actually be a lot easier to talk about, how to have someone turn in reports on time. So relate by sharing individual challenges. You don't want to say, oh yeah, I've been depressed before, but it can be helpful that this is a collective trauma that we're all going through and that, there's nothing wrong with feeling this way. Acknowledge different experiences and needs among people. As Chris mentioned, COVID has not affected everyone equally, and it's important to be aware of this and just think about how you can ensure that you're providing equitable resources throughout for everyone in your organization. And finally, practice reflexive listening. Paraphrase to make sure you're really understanding exactly what the employee is saying. So now, some other ways to direct the conversation are really about looking at the behavior, not the cause. So the CDC acknowledges that some of the ways that you might see mental health show up in the workplace are around job performance and productivity, engagement or lack of engagement with one's work, communication with coworkers, and physical capability and daily functioning. So when we're talking about these issues, as we're addressing the emotion behind it, don't just start out with saying, you're being really difficult to work with, but you can focus that. You haven't been participating in meetings as much as you used to, is there anything going on? Again, do not attempt to diagnose or force information. You acted really manic. What's up with that? Mental health language is such a part of our common parlance, but you want to be really careful when you're talking about these issues in the workplace. And avoid making a negative assumptions. This goes back to the idea of mindfulness and judgment. He's always super late to meetings because he's lazy. Well, take a second. So what if we take away that judgment and ask, I've noticed you've been late to meetings. What's going on? And there might be a very legitimate reason why he or she is being late to meetings and how we can address that. So these are really some of the ways to anchor this conversation in a supportive way. And now we're going to talk a little bit about how not to talk to someone with a mental illness. These are just some examples that, again, come from a good place, but they can really affect an employee in a negative way. It's all in your head. Things could be worse. Just try to stay positive. I think these are things that we all want to say and want to be supportive, but they really can be dismissive of an employee's experience. So we want to try to avoid some of these. All right. So now that we have talked about what sort of some of the common mental health challenges are and how we can talk to an employee supportively, Chris and I are going to walk you through how to put these skills into practice in the workplace. And I will let Chris take us away to introduce us to some of our case studies.
Uh-oh.
You there, Chris?
Yeah, sorry, just having had an issue, but I'm here. Case study. So we're going to talk about Diane. Diane has been a very successful manager at her firm for over 10 years. Over the last few months, her firm has laid off several members of her team, and Diane and her colleagues have had to pick up the slack, working extra long hours and weekends. Diane's remaining team members feel very worried about their own jobs, in addition to feeling resentful, overworked, and underappreciated by leadership. In addition, Diane's children have been doing remote learning because New York City went back to school, and she has had to balance supporting their needs with getting her work done. Diane's manager has noticed that she has been more irritable, coming late to meetings, and has mentioned that she is no longer working out and has had trouble sleeping. How should Diane's manager handle the situation? All right, so we're going to take a look at manager response A. I will be playing the role of the manager, and Rachel will be playing the role of Diane. You ready, Rachel?
See.
Diane, what's wrong with you over the past few weeks? I needed those TPS reports a week ago, and I still have not heard back from you about our newsletter.
I know, I'm sorry. It's just been really overwhelming. Our team is trying hard, but with the reduced staff, it has been impossible to keep up with this volume of work. I've been feeling just really stressed out, and it's been hard to focus.
Yeah, look, Diane, we're all stressed right now. If this is the time to step up, you should feel lucky that you still have a job.
Okay, got it. I will figure something out.
Yeah, you better. All right, and scene. I added that last line. I like to ad-lib. Poll, what happened after the meeting? Is it A, Diane's felt motivated by her manager's support and quickly finished all her work? B, Diane felt empowered to go to her executive leadership to let them know that she did not feel supported by her manager? Or C, Diane's physical and mental health continue to decline, as does her work performance. All right, let me launch this poll. Oh, actually.
I know, I don't know that we need. There we
Okay.
go.
Solid.
Wow.
I think we have an overwhelming majority here.
I think so, yes.
Okay. Let me share the results. Oh, there we go.
And it looks like you all get an A+.
Nice. All right. So yeah, what happened after the meeting? C, as many of you chose, Diane's physical and mental health continued to decline, as does her work performance. Right after the meeting, Danielle sends her co-workers a terse email telling them to shape up or ship out. She starts sleeping even less and feels groggy and increasingly anxious. Finally, she goes to her doctor, who instructs her to take a leave from work to focus on improving her health. Diane takes a 6-week leave, negative financial cost to the employee because now she may not be receiving the same amount of pay, right? If she's, if her sick leave is not fully compensated. Increased workload and emotional strain on the remaining team members. So now people have to fill in the gaps for her work. And then there's lost productivity because instead of 10 people doing the work, it might be now 9 if she's out of the office, right? So clearly that manager may not be in this training. Hopefully a manager, yes. So let's take a look at what may happen to a manager who has attended this training and how they might respond to Diane. Hi, Diane. It's been a while since we've checked in. I wanted to see how you're doing.
I'm fine.
Okay. I wanted to check in because I noticed that there are a few deliverables that have fallen behind. And I heard you mention that you have not been working out as much, which I know is very important to you. You don't seem yourself lately. Is anything up?
You know, things have just been really hard lately with the reduced staff and just trying to keep on top of everything. You know, we have fewer people and more work, not to mention that my kids are doing remote schooling, which is very stressful and time consuming during the day.
That does sound really hard. I know I have been feeling very anxious about what has been going on recently too. And the news can be very overwhelming right now.
Yeah, thank you. It is really challenging. I mean, I've been working 10-hour days and I can't sleep at night because I have so many thoughts going through my head. And sometimes it seems as though people are acting as if this is business as usual, which it is clearly not.
I'm really sorry to hear that, and I want to help and make sure that we come up with some ideas to mitigate the stress. What can we change to make work easier?
Um, You know, honestly, I think we need to look at some of these deadlines and think about what can realistically be accomplished with our reduced team.
That makes sense. I will follow up with some of the other directors to identify priorities right now and what can be pushed to a later date. I will make sure to get back to you by the end of the business day tomorrow with an update.
And And I guess if we're talking, it would be really helpful if we could move our morning meetings to later in the day. I have to get my kids set up on Zoom in the morning, and it's really hectic to balance both of those things.
I didn't know that. Thank you for telling me. We can definitely move our meetings to the afternoon. Is there anything else that you would like that you think would be helpful?
No, I think that sounds good for now.
Thank you so much for sharing these concerns with me, Diane. I really appreciate it and want you to know that I'm taking this seriously. I'm going to reschedule our morning meetings to the afternoon and reach out to the team to prioritize deliverables over the next few months. Let's plan to follow up in our weekly check-ins so that we can see what's working and if there are any additional tweaks that can be made.
That sounds good.
Finally, I want to remind you about our free employee assistance program. I have reached out to them in the past when I was feeling very stressed, and they were very helpful. They are available for both you and your family, and I encourage you to take time to reach out if needed. And scene. So now we have a new poll. What did the manager do well? Focus on the behavior and not the cause of that or diagnose. Relate to Diane by sharing his own individual challenges. Downplay Diane's concerns. Shared resources to access support. Asked open-ended questions. Told Diane to stay positive. Assumed that Diane was turning work in late because she could not handle her job. All right, so we have another poll. Select all of the answers that apply.
All right, we'll give it a few more seconds. All right, should we end polling?
Yeah.
All right, now let's see. What did the manager do well? Do you want to go to the next slide to show us the responses? Looks like
Yes.
folks did another great job on this. All right,
Yes.
so Chris, you want to walk us through?
Yeah, sorry about that. So yeah, so the manager definitely focused on the behavior and not the cause or tried to diagnose, right? Related to Diane by sharing his own individual challenges, did mention that they have been feeling stressed, I understand, and had used the EAP previously. Shared resources to access support, again, spoke about the EAP and how it was helpful for them and that it is available. And throughout the whole dialogue, the manager made sure to ask open-ended questions, right? So that gets to that, trying to investigate with kindness, right? So let's ask these open-ended questions, allow the people that you are supervising to answer, right? In ways that aren't just yes, no, okay, right? Let them fill in with open-ended responses.
Mm-hmm.
All right, so what happened after that meeting? Diane holds a staff meeting to address employee concerns about workload and shares a plan to prioritize different deliverables. She also shares that she has been feeling very stressed, is working to address the issue, and encourage her team members to reach out to her and the EAP if they are feeling the same. Diane's manager reviews the current work deadlines and creates an updated deliverable schedule and puts items that are not current priorities on hold. He also reschedules their meetings to the afternoon. Diane slowly begins to start taking walks to get back into physical activity, which helps her with her sleep and in turn boosts her productivity.
Thank you, Chris. So this is a really helpful checklist that we will also share after the training. But this is really just to take a step back and walk through all the different steps that are part of having this initial conversation with the employee about mental health. Identifying resources, again, preparing yourself emotionally for the conversation, scheduling time and private place for discussion, and as Chris said, asking open-ended questions, demonstrating empathy and vulnerability, and then sharing resources for mental health and employees to use them. Thank you so much, Chris, for doing this lovely case study dialogue with me. And so we're about to finish up and move on to questions, but I really want to talk about how managing for mental health not only has the opportunity to improve your employees' mental health, but it really has a cascading effect across the team. As Chris said in this last training, once Diane's manager supported her, she was able to take a moment and work to support her team and offer them the same resources. Your attitudes and actions create a ripple effect among your employees and really just set the tone for creating a workplace culture where it's okay to talk about mental health. Remember that your employees are your greatest asset. When they feel confident and engaged in their work, it boosts morale and productivity. Part of being a manager is really guiding a full team to success. And the best way to do that is to make sure that everyone feels supported at work. And by managing your own mental health at home, you create the space to really support your employees and affect their lives both at work. So thank you all so much for participating. And now we are going to move on to a Q&A. We had some great questions that came up in our invitations. So I will talk about some of those and start out with. But in the meantime, feel free and please chat your questions in here and then we will work to answer them. I'm also going to post a link to our evaluation. It really helps us if you could fill this out to help us talk to our leadership about, why this work is important, how we can make ourselves better and continuing to provide services and resources that folks find helpful. So while folks are adding in their questions to the chat, I will start out with some of the questions that came in prior. So there were a lot of questions, I first want to say, that were about performance management and how to hold people accountable. And that is such a huge topic that we are really going to focus on that in an entire session next week. So if you're not enrolled in our session next Tuesday, please enroll and we will be discussing that in detail and some of the challenges. One question that an employee asked was about how to bring up mental health in the workplace when you are worried about stigma. And I think that's such an important question. And I think, as an employee, it can be really scary to bring up these issues if you don't know that your workplace is going to support it. And, something that we have always said is that the workplace mental health is a cultural issue. So I would start out by hopefully now with COVID, there are a lot of opportunities where people are saying, okay, we need to address these mental health issues. Starting out with your EAP, Employee Assistance Program, to see if you can share some information can be a really helpful way. Start out small with your team and then think about, if there are ways that you can spread this information out. But you don't have to disclose your personal mental health challenges when you're talking about the importance of really how to promote mental health across the workplace. So that's some of the recommendations to start out. All right, great. We have some questions. So one of the questions is that, do you have a training that can be used for employees or volunteers? On our website, we have several resources talking about practicing acceptance and mindfulness as an individual, and we encourage you to share those widely and publicly. We are also looking to offer a training for volunteers and management volunteers, and so look for some information around that from us in November. Now, here's a question. How do you get executive leadership to be on board with prioritizing changes requested by employees, especially related to workload? Chris, do you want to talk about this one a little?
Sure. So there's a recommendation that we make called building the business case, and this is something familiar to a lot of people trying to engage their leadership in conversations about workplace mental health. We often have to show them the business case and how this relates to productivity and to the administration of services, right? For those of us that work for nonprofits who may not be concerned so much about financial productivity, but want to make sure that we ensure that our services are being performed as strongly as possible. So a lot of conversation is about supporting employees so that they are able to perform the best that they can perform. So that's one of the ways you promote the business case and get leadership to understand the importance of supporting initiatives, right? And so in this particular question, prioritizing changes requested by the employees is very important to garner feedback from your employees about things that they may feel are necessary to support them, right? So if you're in that process, excellent. And then you show that to leadership and try to paint that picture of why these things are necessary, because employees are asking for it. And as we mentioned earlier, 80% of employees report job satisfaction when they feel supported around their mental health challenges, right? And when there's job satisfaction, that increases productivity, that reduces turnover, right? And we all know that turnover is a major pain. It is a large financial cost to an organization because you have to train someone, you have to spend time trying to identify a new employee, and you have to spend time training them. That takes away from productivity, that costs money. But also, you know, you want to retain your staff that are strong, that have been with your organization for a long time, that have been successful, and we don't want them to leave. We want them to stay and continue to grow in our organization. So those are some examples of ways that you can talk to leadership about supporting mental health in the workplace and about prioritizing changes from employees. Rachel, do you have anything you want to add?
No, I think you covered it all. And there have been several requests while you were talking about links to our Building the Business Case webinar. We, after this training, probably early next week, will send out an email with some of the notes and some of the key questions and answers, and we will include links to several of our webinars in our website.
Right.
All right.
So we have tons of webinars, all the topics that we mentioned. We'll make sure to include that in the follow-up email.
Yeah, you'll be hearing from Chris, definitely. All right, I think we have one more time for one more question. And again, I just want to say thank you so much. And if you could please fill out our evaluation form, that would be great and really help us kind of continue to make the business case for why this work is important. So the last question we'll take is, how can managers elevate concerns with the executive team regarding staff feeling overwhelmed and experiencing anxiety due to workload? And I think this really goes back to what Chris said initially about building the business case, and also the idea that workplace mental health is a culture change. And I think there are a couple different ways to try to make the case with your leadership about why this is so important. And right now we have seen an increase in employers realizing that anxiety due to COVID and other issues is really critical. You know, I think that there is an opportunity here to try to use this to better the workplace, you know, in general. You know, I think another example is, hopefully, as Chris mentioned, hopefully people are going to stop coming to work sick after all this is over. So all this, you know, has been a really challenging time. It's an opportunity to look at what we're currently doing and how we can do that better. And, you know, hopefully your managers will realize, you know, we need to reprioritize. This is not business as usual. This has affected every facet of our lives. And to really try to prioritize that with your executive team. But I don't say that that's easy, and I don't say that that will always work. You know, I think we try to engage, and it can be a slow process, but I want to be mindful that it's really challenging and that, you know, this will take a while. But so if you could go to the next slide, Chris, I want to make sure that we share some resources for folks, especially for those who asked before this, if there were mental health resources. Here are some free resources that Thrive offers that are available. I encourage you, share them widely. You know, NYC Well is a great resource if folks don't currently have like healthcare coverage in their workplace. And Finally, I want to say a huge thank you so much. Thank you to all our lovely participants from London to Detroit to Brooklyn. Thank you so much to Kristlyn Logue for leading us in this conversation. And thank you so much to Alex for guiding us through our chat. We really look forward to continuing this relationship. I encourage all of you to attend on Tuesday when we're going to talk about sort of the next step in this process. We will answer, since we couldn't get through all of these questions, we will answer some of them when you all receive your follow-up from Chris. Chris, am I forgetting anything?
No, we will also include the link to Tuesday's training in the email. We're going to send that out this afternoon. This session has been recorded. I'm not sure the recording will be ready this afternoon, but it will be on our website where our recordings live. I will point you in the direction of where those recordings are in the follow-up email. And that's all that I have.
Awesome. Thank you everyone so much for attending this. We really appreciate it. Have a great weekend and look forward to seeing you all on Tuesday.
Yes, yes, yes. Everybody have a great weekend. Thank you.
Thank you.
Goodbye, everyone. Thank you.